Hi guys, so I made a post 2 days ago about the right way to becoming a nurse, like a registered nurse. And a lot of people were not happy with my post. Why? I mean, why are you not happy? I don't seem to understand why my post should be a big deal to you. Okay, it's very simple, very, very simple. I made a post about nurses and other people impersonating nurses, like impersonating nurses. What do I mean by this? Nursing is a beautiful profession. We all know that. There's no doubt about that. It's a noble profession. But a whole lot of things is happening to this profession. A lot of people impersonating, imposing, and all that. You see so many people who pose as nurses when they are not. Okay, personally, I don't have a problem with you learning whatever you want to learn in any hospital or private hospital you wish to learn it. It is not my problem. My problem is when you're done learning whatever you're learning, remove the title nurse from your name because you don't earn it. Before you have the title nurse, you have to earn it. Okay, I was explaining that if you did not go to any school of nursing and you did not sit for any qualifying professional exam under Nursing and Midwifery Council of Nigeria and pass the exam, you are not a nurse. Okay, yes, I said that. And some people were they're like, I don't want to use some particular words on this video because of Mr. Mark, but I believe that you people understand what I meant. A lot of people were on my neck because of that post. And funny enough, if you go under my comment section on that particular post, you'll see people defending them. Obviously there are them defending them. You understand what I mean? Because I don't know why you should have a problem with my posts I made about nursing. If you're not a nurse, it shouldn't be your problem. Okay, so I was trying to educate my followers on the right way to becoming a nurse. Currently, you can pick up a JAM form. Okay, first you have to make credit in 5 core science subjects. You start from there, then you pick up a JAM form. Choose your proposed university, make them your first choice, and apply. Or if you choose the other way around, you can also, because currently schools of nursing, they're now taking JAMB. I think they are now going to turn to college of nursing, meaning that even if you want to go to the university or even if you want to attend school of nursing, you still have to get your JAMB. So when you go through, when you want to become when you want to enter the university, you still have to go through JAMB and you sit for JAMB, sit for your UTME. Then if you're good to go, then you'll be admitted. Okay, then you start from there. When you qualify, when it's time for a professional exam, you write a professional exams, and if you pass, you'll be licensed to practice at the right time. Okay, then if you choose school of nursing, still good. You can also become a registered nurse there. So, but if you did not attend any of these previous mentioned schools, have any business with calling yourself a nurse, please. Nursing is a noble profession, and what we are trying to do, we are trying to protect the profession. Like I stated, I am not trying to, make anybody feel bad. I'm not trying to make anybody feel, I don't know. I'm not against the person, but I am against the practice. Quacks are not nurses. Okay, you can choose any name to call yourselves, but leave the name. nurse out of your mouth. Because if you go back to my post I made about quacks, there were a lot of them under my comment section trying to prove a point. You see a lot of them, they'll tell you that that even if you come to hospital, that some registered nurses, they don't know anything about practice, that it will still be the quacks that will teach them. What? Nga, zip it up. Mechie ya. The truth is that as a new graduate nurse, you may, most of them, or even as a student nurse, we always go to the hospital for clinical posting to 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 practice most of the things that have been taught in class. This will also help you to build your confidence and understand how those things works, not just by reading them, by seeing how it works. Okay, so if as a student nurse I'm unable to carry out a particular procedure, I have my seniors there to help me. Okay, I have my chief there, I have my director of not my director, any director in my ward. I have colleagues to coach me. Yes, you can actually during ward rounds you can also join doctors. Yes, they will teach you. If you have any question, you ask them, they are willing to help. If you're in a ward, you have a particular case and your chief is there, if you don't understand it, you ask your chief and she's willing to put you through. So you don't come under my comment section to tell me that quacks teach nurses, registered nurses, and you know it is a big lie. I don't know which hospital that quacks teach registered nurses. We have our chiefs, we have our directors, we have our seniors to help coach us. So I don't know which hospital exactly that quacks help to teach registered nurses. You know, sometimes some people can just come online, they'll say a whole lot of things just to prove a point, which doesn't really make sense. Okay, this video is already very long, so I didn't really plan it to be this long. But what I'm saying in essence, in summary, to become a nurse, to become a registered nurse, you have to sit for their qualifying professional exam, which is council. Like if you entered as a generic nursing student, you have to sit for your basic nursing first. That's your RN. And when you sit for this exam, you pass this exam, you'll be licensed as a registered, like a certified nurse. Okay, not some people that went to some private clinic to learn one or two things and you come out to give yourself the title to nurse. Sweetheart, you're not a nurse. Okay, take it or leave it. I'm not trying to make anybody feel anyhow, but you're not a nurse. Until then, someone will still come to my post to tell me that because that some people are fortunate to read nursing doesn't mean others have the same opportunity. My dear, nursing is an evidence-based practice. It's not just all about carrying out vital signs and doing things because you saw people doing it. You have to know how those things works. You're supposed to know the rationales for each procedure you're carrying out. Okay, you understand? So you don't just come and like kind of use emotional words on people. We deal with lives and not animals. Even animals are being taken care of by professionals, not just anyhow person. We have veterinary medicine, veterinary doctors. They are professionals that read thoroughly the anatomy of different animals. Okay, they read it for 6 whole years. So even animals have professionals that take care of them. Talk more of humans. So please, in nursing, we don't like I don't know, we don't make things look lighter than it's supposed to look. No sentiment. The truth still remains that if you're not a nurse, you're not a nurse. So remove that title from your name. So for those people that feels like, what if I cannot afford it? If you cannot afford it, leave it to when you can afford it. If you cannot afford it now, you can afford it in future. Okay? So you don't tell me because you love doctors and you want to become a doctor and you're unable to, okay, you're not able to get admission to study medicine, you're not able to pass your MBBS, then you can now impersonate them because you're not able to practice it. You can now start learning and now call yourself a doctor. Does it work that way? That you went to one pharmacy, like a pharmacy shop, or you met one pharmacist to learn about drugs, doesn't make you a pharmacist, sweetheart. So people should allow nursing breathe. Thank you.